kidney failure, we are going to answer this question: how do you know that one has renal failure? Renal failure is the same as kidney failure. Sign and symptoms, investigations. So everything is around this important organ. Once this organ is failing, we are going to see different symptoms and signs. There will be fatigue, general lethargy, that's a weakness, shortness of breath, progressive weakness. There is a possible thirsty, anorexia, you don't feel have appetite, weight loss, diarrhea, and possible vomiting. Now, when you check in the history before this renal failure comes into place, you might find that there was a recent or congenital hydronephrosis, where we have a lot of water around the kidney. It's a urine that is not eliminated due to malformation or due to other tumors maybe, or other causes that will lead to hydronephrosis. It can be trauma, whether blunt trauma or any other traumatic injury that might go and damage the kidneys, or just fractures of the bones. It might be nephritis, an infection coming and destroy the glomeruli, the part of the kidney which was previously normal. Then you find it getting infected. Infection is here, is busy damaging these important structures, then to cause a severe inflammation. Nephritis, also called the acute glomerulonephritis. Urinary retention might be caused by different causes. Might be tumor, like cancer in male and female. Once it comes and then blocks the bladder, then the urine will be returning back. This is a normal flow normally, but if there is any obstacle, like in a male, you can have stricture secondary to prostate enlargement, prostate adenoma, or prostate cancer. There are many causes, or it can be neurologic, as we said, as we saw in the previous presentation. It can be renal cysts, the abnormal kidney with a lot of cysts. Then this kidney is not functional. It can lead to renal failure. Nephrotic syndrome, where the patient will be losing proteins in a massive way. The loss of proteins will lead to edema, which will be generalized, because the protein normally they bring back the water in the vessels inside the bloodstream. Once there are no protein in the blood, the water will leak out, then it will be under the skin, as we see puffy face, periorbital edema. You can see what we call pitting edema. These are the signs and symptoms. So in acute renal failure, if it's acute now, you might find the patient with edema, nausea, origuria, that's a very scanty urine, anorexia, the lack of appetite, vomiting, or poor skin turgor. You can see the skin can be dehydrated. And when you check now for chronic kidney disease, the patient might have anuria. Anuria, it means absence of urine. The kidneys have shut down completely. Anemia, shortage of blood. Pruritus, itching of the skin. Lethargy, severe weakness. Anorexia, you don't have appetite. Headache, disorientation. The toxins now are increasing in the body, then it affects the brain as well. Then the patient might be disoriented. Muscle cramps or twitching. Now, when you do more investigations, you check in the urine. Normally, important nutrients, particles that are very useful for the body, which are not supposed to be passing, they will start now passing through this filter. You see, this is the same. This is just an example. The filter normally does not allow big particles to pass through, only small ones. In the context of the kidney, the small particles will pass out with the water, with the urine, then they will be eliminated. But here now, if this filter is damaged, the blood, white blood cells, which are soldiers of the body, the sugar and other proteins will be passing through, which is abnormal. So that is a very bad. Once you start losing very important nutrients in the body, then it will cause serious consequence. More investigations. As you take a blood test, you can investigate what chemicals are in the blood. Is the patient being able to eliminate creatinine and urea? You can also check the electrolyte in the blood. You can do ultrasound. Ultrasound is very important. Then you can also do other advanced one like MRI or CT scan, endoscopy, or renal angiography, where you can now follow through the vessel until the kidney. Then you can do also what venogram, and then you can do biopsy to go and you take a tissue on the kidney and go and investigate what might be the cause of this renal failure. Then not only that, you can, during your examination, take a blood, you can examine hormones like renin, an important hormone that helps a lot on increasing blood pressure, especially when you have hypotension. When the blood pressure is too low, renin will help in recovering of the blood pressure. Erythropoietin is an important hormone which helps a lot in formation of blood. So if the kidney is dying, then the kidney will no longer be able to produce this erythropoietin. Then the consequence will be anemia, a very severe anemia, because the blood is not being formed. So we have seen in short these signs and symptoms and the underlying causes. The next topic we are going to see the complication and management. How do we treat renal failure? How do we prevent it?